client is receiving anticoagulants, the nurse care should include observation for A. Nausea, B. Epistaxis, C. Headache, D. Chest pain. And the answer is B. Epistaxis. The nurse can best assess of the edema in an extremity. A. Weighing the patient. B. Checking for pitting. C. Measuring the affected area. D. Observing intake output. And the answer is B. Checking for pitting. A client who expectorates blood is having A. Hematuria, B. Hematoma, C. Hematemesis, D. Hemoptysis. And the answer is D. Hemoptysis. After a bone marrow aspiration, the nurse should A. Position the client on the affected side, B. Monitor the vital sign frequently, C. Cleanse the site with antiseptic solution, D. Briefly apply pressure over the aspiration site. And the answer is D. Briefly apply pressure over the aspiration site. One of the most common complications of chronic asthma is A. Atelectasis, B. Emphysema, C. Pneumothorax, D. Pulmonary fibrosis. And the answer is B. Emphysema. After thoracosynthesis, the nurse should observe the client for A. Period of confusion, B. Expectoration of blood, C. Increased breath sounds, D. Decreased respiratory rate. And the answer is C. Increased breath sounds. Colostomy can be A. Temporary or permanent, B. Double barrel or end, C. Wet or dry, D. All of the above. And the answer is D. All of the above. Colles fracture is caused by A. Fall on the outstretched hand, B. Fall on the back, C. Fall on the distal forearm, D. None of the above. And the answer is A. Fall on the outstretched hand. In patient with gastric ulcer, A. Pain occurs half to 1 hour after meal, B. Pain is relieved by vomiting, C. Hematemesis is common, D. All of the above. And the answer is A. Pain occurs half to 1 hour after meal. To check for laryngeal nerve injury after thyroidectomy, the nurse should A. Ask the client to speak, B. Ask the client to swallow, C. Ask the client to hum a tune, D. Swab the throat to test for gag reflex. And the answer is A. Ask the client to speak. An effective first aid treatment for an alkali burn is to flush with water and then apply A. Dilute base, B. A weak acid, C. A salt solution, D. An antibiotic solution. And the answer is B. A weak acid. Underproduction of thyroxine produces A. Myxedema, B. Acromegaly, C. Graves' disease, D. Cushing's disease. And the answer is A. Myxedema. During early post-operative period after colostomy, the nursing care should include A. Withholding all fluids for 72 hours. B. Limiting fluid intake for several days. C. Having the client change the dressing. D. Keeping skin around the stomach clean and dry. And the answer is D. Keeping skin around stomach clean and dry. One classic sign of hepatic coma is A. Bile-colored stool. B. Elevated cholesterol. C. Flapping hand tremors. D. Depressed muscle reflexes. And the answer is C. Flapping hand tremors. Pancytopenia is seen in A. Aplastic anemia. B. Iron deficiency anemia. C. Pernicious anemia. D. Megaloblastic anemia. And the answer is A. Aplastic anemia. The vitamin required for normal production of RBC is A. Calcium, B. Vitamin A, C. Folic acid, D. Vitamin K. And the answer is C. Folic acid. Cyanosis is the late indication of A. Hypoxia, B. Hyperoxygenemia, C. Hypocarbogenemia, D. None of the above. And the answer is A. Hypoxia. During thoracosynthesis, encourage patient to A. Cough, B. Vomit, C. Not to cough, D. Speak. And the answer is C. Not to cough. Patient with acute gastritis is advised to take A. Alcohol, B. Non-irritating diet, C. Food with nice masala, D. None of the above. And the answer is B. Non-irritating diet. Flowers position after abdominal surgery. A. Reduces tension on incision and abdominal organ. B. Reduces pain. C. Both of them. D. None of the above. And the answer is D. None of the above. Liver plays an important role in A. Glucogenesis, B. Ammonia conversion, C. Protein metabolism, D. All of the above. And the answer is D. All of the above. Obstructive jaundice is due to accept A. Gallstone obstruction, B. Inflammation of gallbladder, C. Tumor, D. Excess secretion of pancreas. And the answer is D. Excess secretion of pancreas. Adverse effects of insulin therapy accept A. Seizures, B. Coma, C. Hyperglycemia, D. Severe sweating. And the answer is C. Hyperglycemia. Plain insulin has peak action of A. 8 to 12 hours, B. 2 to 3 hours, C. 12 to 16 hours, D. 16 to 30 hours. And the answer is B. 2 to 3 hours. Cretinism is A. Thyroid deficiency at birth, B. Pituitary deficiency in childhood, C. Hypothyroidism, D. Accumulation of mucopolysaccharides. And the answer is C. Hypothyroidism. Nursing procedure to prevent bronchial obstruction. A. Aspiration secretion. B. Postural drainage. C. Use of aerosol nebulizers. D. All of the above. And the answer is D. All of the above. Water cell drainage is useful in A. Pleural effusion. B. Thoracic surgery. C. Open heart surgery. D. All of the above. And the answer is D. All of the above. Agents that increase rate of urine flow. A. Diuretics. B. Antibiotics. C. Antibiotics. D. Antidiuretics. And the answer is A. Diuretics. Before digoxin administration, check A. Respiration rate, BP, enlarged liver and spleen, B. Headache and vomiting because of meningeal movement, C. Pulse rate, D. None of the above. And the answer is C. Pulse rate. Daradar relieves pain in angina. A. Brufen. B. Mucan gel. C. Carminatives. D. Nitroglycerin. And the answer is D. Nitroglycerin.